My name is Tim Cohen, CEO of ALN Medical Management. My guest today is Patty Bowles, Chief of Marketing for ACSI, an accounts receivable and management recovery agency that does a lot of work in healthcare. We're talking today about how the patient pay portion of the physician bill is changing and what it means to physician practices. Patty, how big is this issue? I mean, how much of the total physician payment is now being made by patients as opposed to third-party payers?
Well, Tim, it's continuing to grow, but according to a recent Gallup survey poll, 16% of Americans, which is 1 in 6 adults, are uninsured, and therefore they're classified as pure self-pays. So they would be paying all of the bill, theoretically. As for those with insurance, the portion is still typically 20% with a PPO and 50% of the out-of-network. Of course, this is after their deductibles are paid and they have to pay for their doctor appointments.
So you've got 15% of the population where it's 100% patient pay, and for the other 85%.
Actually, 16%, yeah.
Okay. For the other 85%, it's 20 or higher. Now, many practices just flat don't do a very good job collecting patient money. They admit it. It's something that they have not historically focused on. What are the 2 or 3 biggest mistakes you see physician practices making when it comes to collecting from patients?
Well, unfortunately, you're absolutely right. And I'm not so sure if the practices are making mistakes or if they just haven't thought about it. They don't have the time, the knowledge, or the resources, or the training. I can't tell you how many offices I've gone into, particularly new doctors and dentists. They're literally using their receptionists, their dental assistants, their nurses, their wives to do their billing. And for insurance, then they'll ask them to also take care of all the patient accounts. If I were to select 3 reasons, basically that they don't have any kind of a written policy, and if they do, they don't follow it. They're not using what I would consider a good patient application that makes sure that they're getting all of the demographics and making sure that it's been filled out completely. And lastly, they're not asking for money up front before the services are rendered or throughout the process. Most of them tend to rely on a little sign posted up front that says payment is due at time of service, but they never ask. And they may get the copay, but they won't get the deductible. They'll put it on the application, or they'll put a little handwritten note on the bill saying this is now seriously past due. But bottom line, if there's been no payment, they need to be looking at some kind of a process, and that's what I would look at as the 3 main mistakes.
Part of what your firm does is help people on the back end, particularly with patient balances. What are some of the things that make you guys effective at collecting from patients when the typical practice struggles in this area?
Well, it's a combination of techniques. First of all, we invest heavily in training and certification. The big difference is that's all we do. We're not trying to do a lot of other things. All we do is collect money. And so we also give them a lot of sophisticated and effective resources, particularly skip tracing, because 50% of the accounts that we get are usually mail return and phone disconnect by the time we get them, or the information on the application was outdated or just incorrect to begin with. We use a lot of sources to locate people. Our dialers are locked in to see if we have a good number because our goal is to establish 2-way communication. Unfortunately, in the industry, what we're seeing is a lot of automation. And I understand the reason for that, and it has to be used to keep prices down, but we don't like to do that. We try to always make it a live call because we strongly believe that if we can maintain some kind of a patient relations, we're going to get more payment. We don't like the idea of just harassing and leaving a lot of messages, particularly in the long run, since a lot of people right now cannot afford to pay, but they owe the bill for 7 years. At this time, our biggest goal is to determine which people are just unwilling to pay versus those that are willing to pay, and then take those steps to facilitate that. We do have a lot more equipment to look for assets, property, viewing credit reports, and then if need be, as a last resort, we will take legal action. So we have a lot more resources and leverage.
If you were to give a physician or an office administrator just one piece of advice, what's the one thing that they could best do to improve the performance of their patient collections?
Well, first of all, if I'm talking to the practice manager as opposed to the doctor, I would recommend establishing some guidelines and policies and following them, and to rely on an industry professional. I do a lot of this. This is a big part of my job, is going in and helping them design some type of a policy. And they need to avoid doing what another doctor does, or just getting something off the internet, or just going to some conference and grabbing that application. However, if I'm talking to the doctor, which I do many times, I tell them that their job is to treat the patient and to rely on their staff to take care of the billing process, because often when doctors get involved, that's when everything falls apart, because they don't follow the policies.
So what would you say to a doctor?
I would tell them, usually I'm very, very straightforward with them. I tell them that they need to stay out of it and to hire someone that they trust, and to have that person give them reports, but to provide their employees with the proper training, and to tell the patient that they need to go back to the patient accounts manager instead of saying, oh, that's okay, you don't have to pay. They really need to follow the rules and regulations just like everybody else.
Patty, thanks for giving us this quick overview. You can find my full interview with Patty, where we dive more deeply into a whole host of issues that surround patient collections, at our website, alnmm.com, or on iTunes. Thank you.